B.Pharm is 4 years course, and after 1/1/2003, B.Pharm course is not recognized in USA. Most of our pharmacy graduates used to go to USA and they used to work there. But after 1/1/2003, 4 years B.Pharm is not recognized. And to have online with other developed countries, Pharmacy Council of India has started a Pharm.D 6 years program. The syllabus is on par with any other developed countries. And after completion of this course, they will be given Pharm.D degree, Doctor in Pharmacy. So, MBBS, just like MBBS doctor, they can also write as doctor before their name. In Andhra Pradesh, there are 32 Pharm.D colleges, out of which 10 colleges are situated in and around Hyderabad. And coming to the fees structure, 67,500 is the convener quota fees, and 1.51 lakhs is management fees. That means for 6 years, so approximately 9 lakhs fees has to be paid to the management. Pharm.D course is 6 years course, Doctor of Pharmacy, and after Pharm.D only they can go to PhD. So there is no PG course or master course in between. So after Pharm.D they can go for PhD. That is one thing. And the difference between doctor and Pharm.D, so doctor, MBBS doctor, he diagnoses the disease and writes the prescription. And pharmacist will assist, will help the doctor or counsel the patient with regard to the usage of the drug, how much to take, how long to take, when to take, like that. Because when 5 or 6 drugs are written by doctor, when all the 5 are taken at one time, this becomes a test tube. All the drugs will be mixed inside and several side effects will happen. So his duty is to study the pharmacokinetics, pharmacodynamics of all the drugs and advise doctor accordingly. For your information, sir, recently I met the chairman of one corporate hospital. They appointed a clinical pharmacist. After appointing the clinical pharmacist, the bill on drugs reduced by 25% because this clinical pharmacist was used to audit the prescription of all doctors. So he is consulting doctors, sir, why you have written these 2 drugs contain almost similar drugs. So like that he is used to interact, and doctors also used to interact with this person and before writing prescription. So he helps, he is in between the patient and the doctor. He is in between the patient and the doctor.
After Pharm.D, if you do a PG diploma in clinical research, it's about 18 months to 24 months, different universities they offer. If you join a multinational company for drug trials, the salary offered is 1 lakh to 5 lakh rupees per month. There is a huge shortage of manpower doing clinical trials. Qualified people requirement is Pharm.D plus PG diploma in clinical research. You can search in the website and that makes a very good career. Between BDS and Pharm.D,
yes.
If you want to be in India, and for a girl, BDS works out very well, but you have to do MDS course. If you do MDS, your career is very bright. If you have somebody who can sponsor you to states, do Pharm.D. If there is any links and inclination for you to go to states, think of Pharm.D. and think of a clinical research diploma or degree, then go in that line. In India, Pharm.D as such, unless there is some multinational clinical trials, BDS and MDS stream is better.
I disagree with Dr. M.VENKAT
from this side, yeah.
Even in India also Pharm.D is better because medical council has in principle accepted to pass a resolution that every teaching hospital must employ at least 1 Pharm.D person. Therefore, the opportunity is definitely, because by the time you complete it will be 6 years, definitely in India also Pharm D people will have better opportunity.